Last week I gave a presentation that's bringing together the many topics that we discuss in these videos into a program of work in learning health system science. How do we become a health system that continually learns from the care that we deliver? I have 3 different titles here at UT Southwestern, and you might wonder, because I've wondered, how do they connect? They really connect from the idea of learning health system science, learning how to be a learning health system. All the different pieces that I've been talking about in these videos, from being the director of the Clinical Informatics Center, doing applied informatics research, the Gurry Award, which is going to help us build a simulation center and a program of simulation science, the CTSA grant proposal that we'll be resubmitting, and the Chief Learning Health Officer role that I have in the health system. They all connect into this idea of learning health system science. Well, what is that? We all know that there have been a lot of advances in biomedical discovery over the years, yet translating them to practice is slow and difficult to sustain. The ideal way is that a scientist has a hypothesis, they design an experiment, they collect the data, they analyze the data, they write a paper, they publish guidelines to help clinicians. A clinician reads the guidelines, and that clinician then changes the way that they practice. But the problem is that the people who generate the knowledge, the scientists, are not the people who use it. And so there's this really big gap between the discovery and the implementation. An example of that is that we know that lowering LDL-C reduces cardiovascular morbidity and mortality. And the UT Southwestern has a great history in the development of this knowledge. However, more than half of our own patients with atherosclerotic cardiovascular disease don't achieve the guideline recommended levels. The Learning Health System Science program seeks to bridge that gap. There's been a revolution in data that's created a new kind of science in addition to the hypothesis-driven science. We are collecting all kinds of data from people around us, and we can use that data to generate hypotheses. That's data-driven science, but it has the same problem that the traditional hypothesis-driven science has. So, for example, you may use data to identify that polygenic risk score can identify patients at high risk for CVD, but patients aren't identified in clinical practice. If you're me, you can spend a big part of your career developing natural language processing tools that can extract clinical information from text, but those tools aren't embedded in clinical workflows to inform decisions. There are many predictive models, as we've talked about, built for sepsis, readmission, et cetera, and very few of those are implemented at the point of care. The problem isn't the science. The problem is that the same structural gap exists between data science discovery and clinical implementation. We haven't built that bridge. The learning health system gives us a framework to do that because the research system and the care system are the same. Every time a clinician makes a decision, data about that decision is captured and can be used to improve the next decision. And in this way, you can test things out more quickly because you're not waiting for long clinical trials. Instead, you're testing and deploying things in an agile way and learning faster within the clinical care system. The learning health system turns every patient encounter into an opportunity to generate and apply knowledge. It starts with practice to data. You're collecting data from practice, and you identify problems in how you're caring for patients or problems in certain populations of patients not meeting, the guideline directed care, for example. So you collect more data and to understand the problem and generate a hypothesis for why that's happening. From there, you develop an intervention, you implement it, and you test it in real care, and you get this virtuous cycle. Take a look at Kari and Gorm in their last minutes of relaxation before our family guests arrived for the weekend, bringing cousin dogs Archie and Strider to visit. They had a great time together.